So for this validation today, I'm going to go ahead and set up my sterile field, and then I'm going to go and change Miss Hollow's wound dressing over there. To start, we're going to do the sterile field first, and before I even open the wound care tray, I'm going to check for expiration and integrity of all the contents within the tray. Once I do all that, I'm going to go ahead and peel open the wound care tray away from me like this. I'm going to go ahead and take my sterile gloves, open them up, making sure the arrows face me. I'm going to take these flaps right here, making sure not to touch the inside of the packaging. Flatten it out a little bit. And now we're going to put my dominant hand in first, using my left hand to hold the cuff. I'm going to crinkle my fingers, point my hand up. Once I have my right hand in, I'm going to go ahead and take my forefingers, use the pocket right here, and put my forefingers from my left hand inside the glove, and then threading my thumb in after. So once I can go ahead and touch sterile to sterile, making sure my fingers are all in properly. Now that I have both of my hands gloved up, I'm going to go ahead and take all my contents out from the wound care tray. So I'm going to keep my hands up. Fix my pinky real quick. Hands are up, and then I'm going to go ahead and take out all of my necessary equipment real quick. Making sure not to cross our sterile field that we have made. Now that everything's out of the tray, I'm going to put some of our normal saline into the wound care tray. Now that I've done that, I'm going to go ahead and take our hazardous bag. Unfold it. I'm going to fold it again slightly, just a little bit. I'm going to put it at the foot of our bed. And we're going to use that for all the gauze, all the disposables that we want out of the way once we get to Miss Hollow's wound dressing. Put the saline in the tray, and now we can go ahead and work on Miss Hollow's wound dressing. So from here, I'm going to go and first make sure this is Miss Hollow. So I'm going to check her wristband real quick, and it is indeed Miss Hollow. So from here, I'm going to go and untape the top dressing very lightly, letting Miss Hollow know what I'm doing in the process. Miss Hollow, I'm going to go ahead and untape your top dressing real quick. Let me know if you feel any pain while I do this. Making sure not to be rough with it. And letting her know the process going on. So now that our top dressing's off, we see a little bit of drainage right here, so I would know the amount, the color, and if there's any odor present with the dressing. I'm going to go ahead and dispose of this in our hazard bag. And now I'm going to do the same thing with the gauze on the inside. Again, noting if there's any redness, like right here a little bit, noting the amount and if there is any odor. Now, since this gauze right here is a little stubborn, I'm gonna go ahead and take some saline, and I would just do fill up my cap and pour a few drops just to loosen it up a little bit. Now that the gauze is out, we can now go ahead and measure Miss Hollow's wound. I'm gonna go ahead and use the ruler that we have in our kit and measure her wound in centimeters. I'm gonna go ahead and fold this over just so I see the centimeters. And I'm not gonna put the ruler right on Miss Hollow, but I'm gonna let her know that, Miss Hollow, I'm gonna measure your wound real quick. It's approximately 6 centimeters in length and then 3 centimeters in width. So I'd make sure to chart that down. And also for charting purposes, if there's any necrotic tissue or any other drainage coming that I can see, I'm gonna chart it down using the clock method, for lack of a better word. And in our case, we kind of see a little bit of redness around the 5 o'clock area right there. And so I would chart that down so any nurses coming in can be like, oh, okay, so 5 o'clock, there's something there that I gotta look for. So now that we charted all that, we threw away all the used gauze, we're gonna go ahead and clean Miss Hollow's wound. I'm gonna take my gauze right here. I'm gonna dip it in the saline, and I'm gonna let Miss Hollow know, Miss Hollow, I'm gonna clean your wound. Let me know if you feel any pain. I'm gonna go from clean to dirty, being real gentle, don't wanna irritate any of the skin. I use as many as needed, but it looks like Miss Hollow's wound only needs 2 for right now. Once we're done with that, we can go ahead and do her dressing. I'm gonna go ahead, grab some more gauze, get a little wet with the saline, kind of fluff it up a little bit, and place it inside of Miss Hollow's dressing right there. Do it again. While talking to Miss Hollow, making sure she's okay. You okay, Miss Hollow? Okay, good. Got one more coming in right now. Making sure it's nice, covered. And from here, I'm gonna go ahead and put 2 4x4s right on top of Miss Hollow's dressing. Then to finish off Miss Hollow's dressing, I'm gonna put her ABG pad on. Noting the blue line signifies the sky. So this is gonna be the outside, this is gonna be the inside. We're gonna go ahead, place it right on top, nice and softly. And then since I've used up all my tape, I'm gonna go ahead and just grab some Scotch tape. And then I'm gonna take off my gloves, since taping with gloves on is impossible. Throw these away. I'm gonna grab our tape, and then we're gonna pretty much just gonna make a windowsill from corner to corner, corner to corner, corner to corner. Sal, are you doing okay? Good. We don't want to rip the tape right over Miss Hollow, so we're just kind of approximating the length of the tape needed. Now that Miss Hollow's pad is all taped up, I'm gonna go ahead and grab my label. I don't have a pen with me right now, but what I would, I got a Sharpie right here, and I'm gonna initial, date, and then time it before I put it on. It is the at 6:25. Making sure the label is on the corner. We don't want it in the middle of the pad. And that is for, again, future nurses coming in, being like, okay, so at 6:25 yesterday, Drake Sienkiewicz did Miss Hollow's dressing. And from here, I would go ahead and dispose of our hazardous bag. And then I would ask Miss Hollow if she needs anything else. Miss Hollow, you feeling any pain? Need me to grab you any Tylenol or anything? Well, if you do, let me know. I'm still here for a few more hours. Put the blanket over Miss Hollow.